I'm Dr. Raymund Razonable, Vice Chair of the Division of Infectious Diseases at the Mayo Clinic in Rochester, Minnesota. Today, I'd like to discuss the current status of pre-exposure prophylaxis of COVID-19 in immunosuppressed patients. Tixagevimab-silgavimab has been used as pre-exposure prophylaxis for the prevention of COVID-19 in immunosuppressed patients. Tixil is a combination of two monoclonal antibodies that binds non-competitively the ACE2 receptor interface of the spike protein. It is a long-acting monoclonal antibody that's given every 6 months and had been used under emergency use authorization for pre-exposure prophylaxis. However, because of the emergence of Omicron subvariants with reduced affinity, its emergency use authorization has been paused on January 26, 2023. We have demonstrated that solid organ transplant recipients who receive tixagevimab-silgavimab have significant increase in their binding antibody against the receptor binding domain if they receive tixagevimab-silgavimab. Neutralization inhibition against the strains of the vaccine increased from 46 to 100% among patients who received tixagevimab-silgavimab. However, we also know that the ability of tixagevimab-silgavimab is variant dependent, as shown by the difference in the neutralization activity against BA1 and BA2. There has been several real-world efficacy studies that demonstrate the efficacy of tixagevimab-silgavimab in immunosuppressed patients. One study of solid organ transplant recipients demonstrated that the rates of breakthrough COVID-19 is significantly reduced in a cohort of solid organ transplant recipients who received tixagevimab-silgavimab as pre-exposure prophylaxis. Another larger study coming from Israel demonstrated that among the large population of immunocompromised patients, those who received tixagevimab-silgavimab had lower risk of breakthrough infection, lower risk of hospitalization, and lower risk of mortality. And finally, in the study that was conducted at the Veterans System in the United States, it demonstrated that patients who received tixagevimab-silgavimab is associated with reduced rates of hospitalization, and this is true whether the patients are vaccinated or unvaccinated, although the effect of the monoclonal antibody appears to be more pronounced in vaccinated patients. This is a study that demonstrates the neutralizing activity of tixagevimab-silgavimab against various variants of concern. The control here is Delta. We know that tixagevimab and silgavimab is highly effective at neutralizing the Delta variant of concern, shown here in green. However, as the Omicron subvariants evolve and emerge, the neutralizing activity of tixagevimab-silgavimab has been reduced, as shown in this slide. The amount of antibody that's needed to neutralize the circulating variants have increased. And the more recent variants, particularly XBB and BQ1.1, tixagevimab-silgavimab basically lost its neutralizing ability. Specifically, tixagevimab-silgavimab does not neutralize XBB1.1, which is the currently predominating variant in the United States, with a more than 5,000-fold reduction in neutralizing activity. XBB 1.5 also has comparable antibody evasion compared to previous variants, and it has a very high ACE2 binding affinity. So with the loss of tixagevimab-silgavimab as pre-exposure prophylaxis, what it is out there for the future pre-exposure prophylaxis among immunosuppressed patients, there is a compound called AZD5156, which is again a long-acting monoclonal antibody combination of silgavimab plus AZD3152 that has a very long half-life given every 6 months, and it has a broader neutralizing activity against many variants, including BQ1 and BQ1.1. So this monoclonal antibody is currently being tested in the SOFERNOVA trial, a phase 1 to 3 monoclonal antibody trial for the prevention of COVID-19 in immunosuppressed patients. The primary endpoint will be safety as well as neutralizing activity. This study is anticipated to enroll over 3,000 patients worldwide. The drug will be given intramuscularly, and patients will be assessed, as I said, for safety. Patients are currently enrolling, with the first participant enrolled in December of 2022. Thank you for joining me today. Clinicians can view more information about COVID 19 on the series landing page. Please subscribe to Exchange CME's YouTube channel and check back regularly for updates on COVID 19.